Hello, this is Teresa Kenny from the Hormone Genius podcast, and I'm here with my co-host Jamie Rachi for a very, very special, and I'm honored to be interviewing someone who has so much knowledge. This is Dr. Diane Mueller, and Dr. Diane is the co-founder of the Medicine with Heart Institute Functional Medicine Training School, a school that focuses on certifying practitioners around the world in advanced functional medicine testing. She's a survivor of mold illness, Lyme disease, and chronic IBS symptoms. Dr. Diane Mueller is passionate about helping others restore their health and passion for life, which she has inspired her to do what she's doing now with her husband, Dr. Miles Nichols. Dr. Diane has also been featured in Fox News, Doctor Nandi Show, and over 100 stages and podcasts combined. She has her doctorate degree in Naturopathic Medicine, as well as a doctorate degree in Acupuncture and Oriental Medicine. And I know also that she has written a book called A Survivor's Guide. It's Use Your Mind to Heal Mold and Lyme, a Survivor's Guide for those diseases. So that may be very useful for those of you who are interested in those subjects out there today. So thank you, Dr. Diane, for being with us.
Yeah, thank you for having me. I'm really looking forward to chatting and helping your community.
So let's get started. So I know you have, obviously, like a lot of us who come into healthcare and come into anything related to health, sometimes have a personal testimony or personal journey to that. And you are not unique in that way. So give us just a little idea of how you came to understanding what you know now.
Yeah, and it's like you said, so many of us get into this world and we go through our own stuff. And for me, I started having health issues as a very young child. It started with just severe bloating, chronic constipation, those sorts of things. And then over time, that part got worse. I would sometimes wear a size 4, sometimes wear a size 12, 14, 16 of pants, like in any given day. It was like that much swelling in my abdominal tract. And nothing came up on labs. It's like a very common story where it's like, I didn't have any of the diseases that are commonly looked for in conventional medicine. So I just got an IBS label that sometimes happens. And that was kind of that. That's largely what led me to naturopathic medical school, was basically looking for answers. And once I was in school, I got a lot sicker, and I was having crazy symptoms. I was losing like memory, was forgetting where I lived, was having pain so bad I would have to be carried sometimes, like a really wild world. And I just kind of like almost blamed that on medical school syndrome, because everybody was tired and exhausted and was having weird symptoms. When I graduated and all my friends were reporting they were feeling better and I was getting worse, that's when it kind of cued into the fact that there was other things. And that's when I found Lyme and mold and dozens of parasites and other infections and toxins. And it was a journey, but I now feel super healthy and well. And, it's wonderful to have gone through that, because it's obviously helpful when I can understand these issues that we run into so many times in medicine, where it's like, we're doing all the common things, we're running the basic labs, we're not finding, problems, but we know the problems actually exist.
Oh my gosh. Dr. Diane, that is crazy. And I've heard that before, like the medical school syndrome or whatever, where you basically ignore your body in the name of medical school. Isn't that funny? And then how that was just the sign that there was something going on. But like, when did that trigger trip? Like, what made you take that first move, and what did you discover when you started digging into your health?
Yeah, I mean, it was definitely when the last 2 years of school, that's when I was having to be carried on occasion because I was in such bad pain. I couldn't walk. And it was like random, right? So there were some days, and most of the days I could walk. And then every once in a while, my whole body would seize. And this motion of trying to push out a chair, I couldn't do that. So that was towards the end. And so that was back in when I graduated, which was 2011. And my friends were getting better. That was really when the trigger tripped. And it's everybody was like, oh, I'm out of school, I'm getting better, I'm getting my life back. And I was like, oh gosh, I'm getting way worse.
Did you go to the doctor, or how did you start that diagnostic process?
I had run basic labs when I was in school. So I looked at thyroid, I looked at adrenals, I looked at hormonal levels. So I was already aware of some level of dysfunction, was on supportive supplements and those sorts of things. So that was done when I was in school. And after that, I ended up running a lot of my own labs because I can, but also because so many people in the chronic disease world are treating things from a very aggressive standpoint, like a lot of very intense antibiotics. And there's time and place for that. But I was really concerned about going that route for myself because I already had so many digestive problems. And it's like, for me, it's like, if I go this route that is more standardly approached, I was really worried that I was going to make other parts of me worse. So I partly ended up in self-treatment just because of the fact that I could, since I do have this medical training, but also out of necessity because I couldn't find anybody at that time that was treating in a way that I felt like was the right thing for my body.
Mm-hmm. It's interesting because I am a women's health nurse practitioner, Dr. Diane. So I'm in conventional medicine, but I have this, like, I'm not certified in functional medicine, but that's just where I feel like my passion is, my heart is. And, even for my own kids and myself, I constantly thinking, okay, my daughter, you have irritable bowel symptoms. I don't really want to take you to the conventional doctor. Like, in my mind, I know they're going to get labeled with this diagnosis and they're really not they're going to give a Band-Aid or a pill for the symptom, but they're not going to find the underlying root cause. So, I can understand, and especially being a naturopathic doctor, you're like, you already know that too. So you can run the basic labs. You can make sure you don't have like Addison's or an adrenal crisis, something like that. So once you got to that point where you were like, okay, I don't have anything like major going on here, then you're like, okay, I got to dig deeper. And did you at that point, even with the training, because obviously you had been through a lot of medical school, feel as if you didn't have the answers almost, or like that there was, even where you were at, still so much more to learn?
Yeah, I mean, that's definitely a huge, interesting thing. I think that a lot of us figure out when we get in school, right? Is like, the more we know, the more we don't know. And, and like graduating, it's like, well, I didn't really learn, I don't even know that we talked about mold illness in school. Like, they might do that now because I think there's more awareness of that in the profession now. But when I was in school, like, some of these things, we didn't talk about them just because the research and the awareness wasn't there yet. So some of that, I think, also was in part just to where the industry was, of needing to do my own research, because it wasn't something that I think most of us are taught in our programs.
So what was your first step, Dr. Diane? Like, as you were, going through this process of trying to get to the root, I mean, did you have the thought of maybe it's mold, maybe it's parasites? I know that's what you said that you were dealing with. But kind of walk us through that. Like, I can imagine some of our listeners are thinking, oh my gosh, I never thought about mold. And I've been struggling with this chronic thing for a long time with no answers. So I'm sure a lot of listeners are thinking, like, their ears are perked right now, thinking, might this apply to them? So what kind of advice would you give them? And how did you, unfold that it was the mold and the Lymes and all that?
Yeah. And mold is, I think, in particular for your ladies community around fertility and female hormones and health, a really important topic, because mold will cause female hormone imbalance. It will cause thyroid imbalance, which we know, of course, is connected to female hormone imbalance as well. And one of the things to realize in being, one of the pieces of advice is like self-advocacy, right? But one of the tricky things about self-advocacy and bringing it to your doctor is that it's not as well of a known thing. And typically a lot of how people are actually oriented to mold and mold illness is thinking about mold like it's a mold allergy. And that's not what we're talking about here. Like, we can actually have a mold allergy where we're around mold and we have like the runny nose, the itchy eyes, our classic allergy symptoms. But that tends to not cause hormonal disruptions in the same way, to the same level that something like mold illness will cause. And mold illness, what we're really saying there is it's actually a genetic disorder. And it's a genetic disorder that affects about 24%. This genetic anomaly affects about 24% of people. So it's real common. And what happens with this genetic anomaly is that actually is changing. The easiest way to have like been able to say this from a non-medical way is it's changing the way our immune system actually sees and identifies mold toxins. Meaning if we have the genetics and we're around mold, we breathe in the toxins, and our immune system, due to our genetic anomaly, does not tag the toxins as bad. And when the immune system's not able to do that tagging mechanism, then what happens is it's basically like the immune system doesn't see the mold toxins. When it doesn't see the mold toxins, then it doesn't actually remove them. So we have this more mold toxic buildup that is at the problem, and that can cause actually dysfunction in some of our brain chemistry and some of the brain hormones that from an upper level standpoint will trigger the ovaries, the adrenals, the thyroid. So the mold toxin buildup causes the brain chemistry to be off, the brain hormones to be off. That has a trickle down effect then of doing a wide variety of things, but one of them is causing hormonal imbalance.
Oh my word.
Yeah. So important.
A lot, right? It's a lot.
A lot. But it's so important. And I think what you brought up about like, this doesn't affect everybody the same way is also really important, because we know mold is kind of everywhere. Like I've seen it in my house. We know, I think you gave a quote in another podcast about 50% of business buildings have had water damage. So the environment and rain and everywhere, I mean, like states like Florida, there's mold everywhere, but it doesn't mean every person exposed to mold is going to exhibit mold illness.
Correct.
So we need to remember that, but we also need to know like what symptoms do we look for? And, also this is when you've ruled out other things and you're looking at yourself going, okay, I still have these symptoms. I need to dive deeper. What are those symptoms?
Yeah, I love that you're orienting this to like when we've looked at other things, because I think one of the things that can happen when we hear these like wild things like I'm talking about, like even though this is very common, right? It can be so almost like exciting to be like, oh, maybe I learned the thing. And we want to consider that, but we always want to start with the basics, because sometimes it is as simple as like, well, you're just not making enough progesterone in the second half of your cycle. And that's the problem. Mm-hmm. So sometimes it is that simple. So making sure that we're doing the basic things, thyroid health, sex hormone health, gut health, adrenal health, all those types of things. But one of the big keynotes when we're talking about keynote things to look out for to determine if we should go down this route of looking for mold and mold toxins is multi-systemic impact. So if the only thing that you have wrong in your body that is out of balance that you're working on bringing into balance is fertility and trying to get pregnant or some sort of female hormone imbalance, and you don't have any other symptom, you sleep well, you have tons of energy, you have no pain, you have no headaches, your gut works well, your mood is great, everything else is great, it's probably not going to be mold. Because almost always, because mold causes such a neurological impact that almost always you're going to see symptoms in different places, where from more of a conventional standpoint, you might be thinking, okay, I got to go see my OB doc, and now I got to see my gastroenterologist, or maybe I need to see my neurologist for my migraine, these types of things. So if you're starting to see like, oh, you need to see a different type of a practitioner because of different systemic involvement, that oftentimes is a keynote symptom. One of the things that is almost always present, not every time, but I would say, 90 something % of the time, is pain of some type. Now that could be joint pain that looks like arthritis, that could be neck pain, that could be jaw pain, that could be headaches, migraines. So it could be all sorts of different types of pain, but pain is almost always present with mold.
So let's say, somebody listening to this podcast is like, okay, so, I'm feeling goofy, I'm not getting pregnant, and I have terrible migraines or joint pain. Okay. What would be that person's first step?
Yeah. So, once you've run some of the basics, looking at some of the things we've talked about, then the next step is going to be finding somebody, if you want to go down this road, which I would recommend if you're, if you have the symptoms that you're mentioning, I would recommend working with somebody that does work with mold illness. So, finding it, and that, there are a lot of conventionally trained people that have done the route of studying this stuff, but like anything, it's like, there's certain things I don't know it, anything really about surgery, for example, like somebody has a surgery question for me, I'm going to have to refer that out. Right. So we want to make sure that we're finding somebody that understands mold illness And, whether that's a functional, natural type of doc, whether it's a conventional doc, doesn't really matter as long as they understand what this is. And this isn't an allergy. And then you want to get tested. The testing part's a little tricky because we don't have a perfect test yet. So there's tests called urinary mycotoxin tests. And those tests are basically where we take a urine sample and we're looking for the mold toxin. So that's the mycotoxin. We're looking for the mold toxin in the urine. That's generally great. The tricky thing we need to understand with that particular test is having the mold toxins in the urine can actually be a normal thing. Meaning if a healthy person enters a moldy place, they're going to detox and you're going to see mold toxins in the urine. So one of the ways to differentiate when we see that is the combination of mold toxins being there, plus the symptoms that match mold illness. And then the other thing we can do to check and balance there are certain inflammatory markers such as TGF beta 1 and MMP9, which can be ordered from your standard companies like LabCorp and Quest. And those they're general inflammatory markers. So they're not 100% specific to mold, but they're highly, highly, highly correlated. So if we do something like our inflammatory markers that are correlated with mold, the urinary mycotoxins, and we see the symptom picture, you're probably looking at mold illness.
It's interesting. I've seen the tests. I've used the Great Plains mycotoxin urine test. Sometimes I'll think, okay, Teresa, go for it. You can do this. But I always tell my patients, if I'm going to run a test, I feel like I should know what I'm doing with the results. And so the reality is that there are just people that are so much more trained in actually what you do with a positive result. And that's not me. So knowing the people in your community who have studied this, like you said, is so important. So I want to talk about just, again, because we're the Hormone Genius, anything else like in terms of what in terms of these types of illnesses or something else that you are passionate about that may affect hormones, fertility, and, overall like an approach for a holistic woman's health that you have found. And it could even be just lifestyle kind of choices that basically, impact women's hormones.
Yeah. So everything is connected, right? So one of the things we need to think about when we think about hormonal health is we need to think about the gut and gastrointestinal health. So when we have gastrointestinal imbalances, there's a lot of different things that can happen, but one of them, for example, is when we have infections, we can get an increase in an enzyme called beta-glucuronidase. Beta-glucuronidase, when we have a gut infection, it leads to an increase in this enzyme, and an increase in that enzyme is going to change our estrogen recycling. And what will wind up happening is due to this gut infection, we will wind up typically having higher levels of estrogen, and that will throw off our estrogen progesterone ratio. So to tie that in, so that leads us to, okay, hormones, gut problem. Okay. So we want to check our gut health. But another thing that's really interesting is like when we breathe in these mold toxins, the mold toxins can actually get into our microcapillaries, our small blood vessels, and they can actually travel through our circulation because of how our body is connected to our intestinal tract. And the mold toxins can actually cause leaky gut, can cause intestinal inflammation, and can lead us to a situation where we're more likely to get a gut infection because we're inflamed. So if you're following this whole trajectory, it's just another path of how this stuff is connected, is like mold toxins, gut infection, leading to a hormonal imbalance situation. So, if we're, one of the things to really consider, in talking about, hormones and fertility and these types of things, is if you're looking and you're saying, okay, well, hormonal imbalances, right? And, and using like bioidentical hormone replacement therapy, absolutely a place for that. But I would just encourage people, even if you're using BHRT and you're working on, fertility from just that standpoint, or even all the way to, doing IVF and some of these other mechanisms, that you still are asking the reason in your head, like, why do I have this underlying hormone imbalance? And really, there's so many different mechanisms in the body that can lead to this. And anything that's going to lead to a level of inflammation very likely has a trickle down effect that could affect hormones.
So would you say when you were, again, learning that you had these exposures and you were having all these symptoms from it, what would be an easy way for the listeners and anybody who struggles to take care of their health, their gut health specifically, their inflammation? Like, what are some easy things that our listeners can do?
Yeah, one of the things to definitely consider, and work with your fertility specialist or your hormone specialist on this, because there is variation. A simple, easy thing to consider for some people is intermittent fasting. And so that's where we're saying we're skipping breakfast, we're eating dinner, and we're just improving we're shortening our feeding window. The reason for that is that improves something called autophagy. Autophagy is a process when we get into a fasting state for long enough where our cells actually start getting rid of their trash. So the cells actually function better all over the body. And the reason why I say be a little careful about this is because we do want to be careful sometimes with people with adrenal issues in particular. Adrenal issues, if you have adrenal issues and you tend to be more tending to like hypoglycemia, low blood sugar, and that has its, having blood sugar balance is super important on fertility. Doing something like intermittent fasting might not be the best thing if you have an adrenal related issue. And then the other thing, just knowing how much the thyroid impacts sex hormones. We also want to make sure that if you do lower your feeding window, you're still getting a good amount of calories, because even though we want that right calorie balance, right? Not too much and not too little of calories can actually turn down the thyroid. And we know that, too low of thyroid function does affect the female hormonal system. So you just want to be careful when you're doing that. But that's something that does work for a lot of people. Another thing is sleep, and it's like sleep is the most essential thing. And it's amazing to me how many people think they're sleeping. And then when we use sleep tracking devices like our Fitbit, our Apple Watches, and our Oura Rings, these types of things, it's amazing also then when we track that, how many people are like, well, I'm in 8 hours, I'm in bed for 8 hours, but I'm actually only sleeping for 4 of them. And the thing that's interesting is when we get less than 6 hours of sleep, even in one night, so one single night of less than 6 hours of sleep, that next entire day, we are insulin resistant, meaning we have a standpoint where we have high levels of insulin, and insulin is trying to get sugar inside our cells, and our body is having a hard time doing it, which it may explain why so many of us, if we don't get enough sleep, we can start craving carbs, because that's an imbalance that's happening there. We see when we're insulin resistant, that negatively impacts things like estrogen and progesterone and testosterone. So, if you do it for one night, no big deal. Your body turns and starts, re-regulating. It's not like you're setting yourself up for diabetes after one night of poor sleep. But if you do that continually, then that's a big problem. So looking at things that are sleep hygiene oriented, like using red light at night, lowering and using softer light at night, making sure you're off computers or electronics, or at least there's like blue blocking apps you can put on computers and phones. So, getting one of those are usually real cheap, and some of them are even free to put on your devices. So you're blocking that blue light that's emitting from the screen. It's really that blue light that is lowering melatonin production, our sleep hormone. And there's lots of other sleep, hygiene things we can do, not eating too late at night, staying away from alcohol, not exercising too late at night. But when I've worked with my patients on this, the number one thing that I've really seen impact deep sleep more than anything else is that blue light at night.
It's interesting because, I work with a lot of perimenopause to menopause. And of course, you probably know that one of the biggest complaints is weight gain. And I never thought about that connection, because perimenopause, like, people don't sleep as well. That's just kind of also the hormonal imbalances. It leads to that symptom, but that insulin resistance connection is really key probably to why it's so hard for women to lose weight and to gain weight more easily. Do you see that as like kind of one of the most, I know there's the estrogen and cortisol connection, but I had never thought about the sleep and the insulin resistance. So that's cool.
Yeah, it's huge, because that can affect testosterone, as well. And of course, so much of like preventing the weight gain as well is like that healthy testosterone, so we can keep muscle on and that sort of thing. So I feel like there's so many examples of these vicious cycles we can get in medicine, and like the connection between sleep and adrenals and insulin and hormones is a real big vicious cycle that we have to stop in order to get, somebody functioning well. And some of it is doing things like, let's work on the hormones and the root causes. And then other parts really come down to, let's make sure we're setting ourselves up for success by choosing some of these basic lifestyle things that can really make a difference.
So one of the things you said was for women who do have like adrenal issues, or they're, that might not be a good group of women to do the intermittent fasting. But what would you recommend to those ladies if they don't do that, but they have that genetic, disposition and there's mold exposure? How would you help them with that?
Yeah, I mean, there's definitely a lot we can do from a supplement standpoint. So making sure you're doing a lot to support your liver, such as glutathione, making sure you're doing things to support your bile flow, because the whole process of getting toxins out really comes down to your cells releasing them, your liver breaking the toxins down, then your liver has to transport the toxins out of your cells or out of the liver. And then the toxins, basically, once they leave the liver, they go into the bile. Then the bile and the toxins go into the small intestine. And the goal is basically essentially to poop the toxins out. The problem with that is we reabsorb about 95% of our bile, which means we reabsorb about 95% of the toxins. So the idea with this is to get the liver working using things like glutathione, alpha lipoic acid, get the toxins to move out of the liver using things like myrrh, choline, and TUDCA, and then using binders like charcoal, zeolite, these types of things. The goal of the binder really is to hold the bile and the toxin together in the intestinal tract and prevent that reabsorption that happens. So you can actually wind up essentially pooping the toxin and the bile out, and you're not just continually recycling it. And that, even for people that intermittent fast, usually if we have a, mold toxicity, we got to be in a mold-free place, and we've got to do some level of detox in order to get this stuff out.
I've done a charcoal kind of cleanse maybe once, twice a year. Is that something that anybody could do outside of, again, mold illness, just from a standpoint of health, doing a binder like that and trying to just eliminate any sort of toxin? Is there any reason just a normal person shouldn't do that?
It's a pretty safe thing to do. The biggest thing is to know that it binds the good and the bad. So if you're using something like charcoal, you want to take it away from food, from supplements, from medications, just to make sure. And usually you want 30 minutes to an hour to take it, 30 minutes to an hour ahead of food, drugs, supplements, or 2 hours after. That's kind of the window. And as long as you keep in that window, it's pretty safe for most people. You want to make sure that you don't wind up getting constipated, because some of these types of things can actually slow down the bowels. And if you're getting constipated, you're trying to get the stuff out, but it's actually getting stuck in. So for some people, it doesn't wind up being the right thing because it constipates them so much. And then, you're not really, it's almost making the problem worse.
Mm-hmm. It's so interesting. Oh my gosh, Dr. Diane. Okay, so you have talked about, of course, the mold illness, but then also with Lyme's, and that might be a whole other thing. But, we touched on the mold, we touched on the gut, but let's throw Lyme's in just for a minute and talk about that aspect. I know we mentioned at the very beginning.
Yeah. So just so everybody is clear, so Lyme disease comes from a bacteria called Borrelia. And this bacteria is most commonly found in deer ticks, although there have been a couple studies that have shown that it's in mosquitoes and fleas. I've only seen one study of each, so the data is still limited, but it does look like it's not just ticks. So if you're like never hiking, you never had a tick bite, most of us have had a mosquito bite. So there is possibilities of Lyme. Kind of like mold, Lyme is the great mimicker. So it's, again, something to consider when you've tried some of these basic things, you've run the basic labs, you've done some of the fundamental work, and you're like, gosh, things are just not getting better. Again, multi-systems are involved. And typically with Lyme, just like with mold, very, very frequently there is pain, a little bit less frequent than mold, and most textbook Lyme pain moves. So meaning with mold, you're going to have mold pain. It's typically like, if it manifests as a headache for that individual, it's pretty much always going to be a headache. With Lyme, the textbook pain with Lyme is like, oh, it's in the shoulder one day. Now it's in the neck. Now it's in the knee. Now it's in the hip. So it tends to move more. And sometimes with Lyme, I've seen more cases with Lyme than mold where there's actually not pain, even though it's very common. And it's just purely manifesting in like neurological problems, brain fog, weird neurological symptoms of like getting up and feeling super dizzy or feeling, tingling or sensations in the palms, that sort of thing. And just like with mold, with Lyme, you really want to work with a Lyme literate doc, because the testing is not all the same. And the number one test that's actually used for Lyme, as far as the intro test, is called the ELISA. There's one study that actually shows that the ELISA has a 66% chance of a false negative. And this is what we're using as our standard test. So it's like, you want to go to somebody that is well trained with this, who's not just going to be like, oh, I'm just going to test you in the standard way, because you can have a positive actual, disease, but have the wrong test. And, and then you get told that you're fine when there's actually something there.
Isn't with Lyme's, it looks like a bullseye sort of rash thing? Is that with Lyme's?
That does occur with Lyme. We used to actually think that was like the telltale symptom. And like the original studies were like, oh, there's 90% of people with Lyme have this. And now we're seeing some studies that are saying, oh, it's actually like 50% or less people that actually get that rash. So it definitely, it's like, if you have that rash, that's like, it looks like a bullseye, looks like a target lesion, that sort of thing, like a dartboard. And if you have that, then huge, light bulb, Lyme disease, right? But if you don't have that, we definitely have now moved away from the, thinking that, oh, that means that you're Lyme free. You can't use like the absence of that rash to mean that Lyme's not there. Yeah.
I have a good friend, shout out to her, Pam, who taught me about just Lyme and mold. And she's not a medical person. Again, it was her own personal journey where she learned so much. And then she taught me, which got me more interested in this type of functional medicine and diving deeper. So I know I've heard the testing for that is so hard. So if you're out there and you've had a tick bite in the past and you're just wondering, you really need to go to someone who specializes, a naturopathic doctor, a functional medicine doctor who specifically knows how to work with patients like this. It's not going to be easy to go into a conventional medicine doctor and probably get answers. I know this season, I think this summer, actually at my family practice clinic, we saw a lot of tick bites. So, it seems to be an increasing kind of thing. And I know that's probably just seasons and the way bugs are, but we saw a lot.
It's seasons. Oh, sorry, Jamie.
Oh, it's okay. I was just going to say that a friend of mine has a daughter who had that, just like a round rash, but nothing in the middle. And so I thought, well, maybe it was, the mosquito, but not really. Maybe it was the flea. Like, I'm just thinking about why there wouldn't be a center. But anyway, that's just interesting. I didn't know that it didn't have to be a tick.
Yeah. And it's not, even though the classic way the rash looks is this bullseye target lesion, sometimes it is just this flat, non-raised, red, circular thing that doesn't have that middle. So it doesn't necessarily manifest in that perfect form either. Yeah. So that's an important thing to realize as well, is that it can, even though we have the classic appearance, the textbook appearance, it can really look all sorts of different ways. Yeah.
And I interrupted you. So what were you going to say?
I was going to say, what was I going to say? I might've moved on from that thought in my head.
It's okay.
Yeah.
No worries. Oh my gosh. I never knew like 95% of what you are sharing right now. It's super helpful because, again, like you said, if a woman has a struggle with her fertility, we want to go through all the basics, like what are her hormone levels like, does she produce enough cervical mucus? Does her partner, like, what's that sperm like? All those things, right?
Yeah.
But I think that a lot of people like to listen to this podcast is because we do dig a little deeper into some of these issues. And so this just is one extra, tool or one extra, stone to turn in terms of maybe getting closer to an answer. Because you said 24% of people have that genetic, disposition of the mold thing. So even that is a lot. It's not like 5% or right. 10%. That's a lot of people. So again, it's definitely worth looking into. Yeah. And would you say like the mold specialists out there and the Lyme specialists, like this might be like a really long answer, but long answer short, how does somebody become an expert in mold, whatever? Like, are they easy to find? Are they hard? Is there a database?
There's definitely, so there are databases. So there's like the International Lyme and Associated Disease Society, ILATS, for example. And so a bunch of us have our information on there, but not everybody that treats Lyme winds up being on that society. So if you type in something like Lyme literate doc or mold literate doc, you can, usually find something with those types of search engine terms. And as far as how somebody becomes this, most of us become this because of stories like mine.
Mm-hmm.
It's like most of us in this field, because it's such a complex thing, we wind up in this route and this road because we went through it ourselves. And being in this profession and being able to read and have training and reading medical literature and that sort of stuff, it's like that's how most of us wind up just studying and seeing what the literature, has, and taking the CEUs that are available and that sort of thing. And that's generally how we get into this world. But if you're looking for somebody, like that's where I would start. I would generally just start with typing in your search engines, Lyme literate doc, mold literate doc. And, and make sure, it's like I have like in my book, Use Your Mind to Heal Your Mold and Lyme, I actually have a chapter in there on how to interview clinics. Mm-hmm. And I go very specifically in there, like questions to ask and answers you're looking for. So you want to be careful, for example, if somebody says they treat mold, you want to ask them a little bit about like, well, tell me a little bit about mold testing. And if they say, oh, I allergy test, that's like one of your red lights, for like, well, they don't exactly know this mold illness thing. So that's why I go through in that book, how to interview clinics and what answers you're looking for to really help decide, oh, is this the right clinic to help in those sorts of ways?
Mm-hmm. And you do training too. Do you want to share a little bit about what you do for?
Yeah, absolutely. Yeah. Absolutely. So all of my information, the easiest way to just find all my stuff, because I have a lot of different things I do, is just going to my personal website, which is just drdianemueller.com. You'll find my clinic on there. You'll find my training institute on there. And basically the training institute is to help clinicians that are interested in functional medicine and learn more, anything from, basic fundamental stuff like thyroid, all the way up to some of the more chronic things we see, the Lyme, the mold, other types of chronic hidden viral infections, fungal infections, those sorts of things, toxic metals as well. So that's really just help clinicians get more proficient on some of these things that most of us did not get in our medical training. Yeah.
That's so
sounds
cool.
great. Sounds like I should probably look into that.
Yeah, you should.
I'd love to have you.
Yeah.
And it's for like the medical world, right? It's not necessarily for the layperson.
It is. Yeah. We definitely want people in there that have had foundational levels of anatomy and physiology. So I have, several nutritionists in the program, so people do very well at that level. I have MDs in the program. So, there's a wide spectrum of foundational training of where people have, but having some level of like, we don't have to look up every medical terminology word. It's not really going to be for the public because we do speak a little bit at a non-lay person level from that standpoint. Yeah.
Oh my gosh, Dr. Diane. Teresa, do you have anything to ask here before I ask the final question?
No, I was just going to tee it up for you, Jamie. It's just, I wanted to just say to our listeners out there that I know sometimes information can be overwhelming. And so if you're feeling overwhelmed, just remember it's okay. That's a natural thing when we get a lot of information at once. And, if just take today to just kind of digest and maybe take one step in your health further to learn more. Maybe you get Dr. Diane's book if you're really wanted to dive deep, but maybe you just take some of the perspective of the lifestyle, practical things she talked about. All of us can take a little step to bettering our health and learning more. And Dr. Diane has provided us a wealth of information today. So we want to thank her for that.
Yes, thank you so much. I learned so much. I'm going to listen to this like 3 times. Yeah, I love it. So important. Okay, so I always ask all of our interviewees, what do you wish every woman knew about her hormone genius?
I wish every woman knew that it is unique and that she does have her own genius. I think so many times we compare ourselves especially as females, to what healthy hormone looks like, what it looks like for our libido, what it looks like for how we, even things like how we look, how our breasts look, how our genitals look. There's so many things that I think society has, say, created on what normal looks like, what normal feels like. And perfect hormone balance is unique from woman to woman to woman, to how that manifests in libido, to how that manifests in brain function. And so trust your body. When your body is on, when your body is off. If you're being told that labs are normal and you still feel off, trust your body more than the labs. Your body is your ticket, is your tool to let you know when you're in balance and not. And if you're being told that everything's fine and it's not, then be your own best advocate and look for somebody that can give you a different answer.
Love that. Well, thank you so much for spending the time with us. Yes, it was so wonderful getting to know you. And we will include how to stay in contact with you in the show notes as well. And yeah, we just so appreciate your time.
Thanks. All right. Thank you, everybody.
Thanks.